Okay, hello everyone. We're here to talk about surveying today. Sometimes you'll find this in week 4, but I've moved it up to week 3, but I think you'll find it on week 4 in your blackboard. And we can get started on our case 1 and case 2, the lower class 1 tooth tissue supported mandibular cast RPDs. The first one will be a lingual bar and the second one a lingual apron. But before we get started, we need to talk about the purposes of surveying and what is it actually we're trying to do. Well, I can start off by whose responsibility is it? It's kind of a heavy word. But generally, in my generation, it would be the dentist's responsibility to survey the case. But these days, the laboratories are working up the treatment plan for the dental offices, surveying the models, dictating the path of the placement, and then communicating this to the practitioners. Although, as we can even go further by saying many laboratories farm out to a third party to do the frameworks of the cast partials, and it's that laboratory's responsibility, but I've seen sometimes that they pass this down to the third party laboratory, and then they're far removed from the treatment plan, and then they just go ahead and make the framework as they see fit. And this is where I've seen some problems seems to occur. It's about responsibility. So even if like most laboratories send it out, it's their job to communicate the design to the practitioner or even survey the model. We've got components of the surveyor. You'll see these visually in the demonstration, in the practical demonstration to follow, about surveying and surveying the height of contours, etc., and blocking out our models, blocking out undesirable undercuts, because we need to, commit to we need to commit to the 9 reasons for surveying. I'm going to go over them here on this quick PowerPoint. You'll find this in week 4. We might move it up to week 3, but anyways, it's under surveying PowerPoint. So here, I think we're all going to use this one this year, the Dental Surveyor by Ney. And you can see that there's the base, a vertical arm, a horizontal arm, the mandrel, and the surveying table. And the surveying table is adjustable. And I'll go over these on how to use it, but still we need to be familiar with the parts of this surveyor, kind of similar to our articulators. We need to know the parts of the articulators. And here is a different type of surveyor. And but they all do generally the same thing. Small ones, large ones, heated tip ones. Some have a slot for a handpiece for milling, which I know Carrie's gone over in 3rd year, which I think we'll still introduce again in 3rd year in 6th semester. So you'll find in your surveyor, probably in the top section there, you could unscrew it, you'll have these pieces. On the far left, you have an analyzing rod, B, a carbon marker holder with some lead that can be held between the 2 sections that go in the mandrel so it doesn't fracture. And then the undercut gauges, there's 3 of them. And you have to commit these to memory, but it's not that difficult. The first one has 1 line on it, the second one has 2, and the third one on the right has 3 lines. Each one indicating a different depth of undercut. If we look here at the top section here. So the one on the left here is 0.25 millimeter undercut. The middle one is 0.5, and the last one here is 0.75. And we are going to go over the types of clasps, and those clasps will have each time a different determined undercut that we will use. Primarily for this semester, we'll be most interested in the 0.25 millimeter undercut gauge for the clasping that we're going to do on our first several cases. And D here is a wax cutting instrument for creating ledges, a little too sharp for blocking out. But anyways, it's a wax cutting instrument parallel to the survey spindle. The far left, go back to the analyzing rod. This is a straight shank. There's no taper to this. Some surveyors will come with also additional ones like a 2-degree taper and a 4-degree taper even 5. But this one, for our purposes, will be a straight shank here. So these are our reasons for surveying. You'll find these reasons, you don't have to write them down, you'll find them in the booklet I gave you, the one with the color drawing on top. You'll find this in there, purposes of surveying. And I want to go over each one. Obviously, number 1 is the most important. Determine the path of placement. Identify guide planes, undercut areas. Evaluate soft tissue undercuts and aesthetics. Restorative procedures and survey lines delineated, which is marking them. And also locating undesirable ones. And today's exercise, tripoding the cast at a given path of placement. So, the path of placement is determining the most acceptable path of placement and also path of dislodgement for the partial. How it's inserted in the patient's mouth and how it comes out of the patient's mouth. When possible, we should try to start parallel to the occlusal plane, or flat occlusal plane parallel to the survey table. So we will start at the, let's say, set 0 position. Also in that booklet, there are step-by-step pictures of what I've done with Kennedy Class 1 mandibular surveying, but we'll also, I'll have a demonstration for that too, either here on video or again in the classroom live. You can see the path of emplacement ABC here, that A is the directional. If you see the left and right lines, this is the direction of the path of insertion of the partial denture, going over the height of contour of the guide planes, distal of 2.1 and mesial of 2.3. If you change that angle, like B, you can see it moving from a bottom left to upper right position. This path of insertion is slightly different. And this is created by the survey table and how we block out these undercuts and try to maximize or minimize the undercuts for our liking. Now actually in this case, this is a very aesthetic consideration of the guide planes of distal of 2.1 and mesial of 2.3. We need to kind of minimize those undercuts. We may even ask the dentist to even prepare the proximal surfaces of those abutment teeth to minimize. If you see the space here near the cervical third of 2.1 and the mesial third of 2.3, there's a space here. And this undercut here can't be, you can't utilize that undercut with plastic or acrylic or teeth, because therefore the denture will not go in and the denture will not come out. And I think you'll recognize that from the acrylic partials that you had created a previous semester, that you had a hard time getting it off the model without breaking it or getting it back on. And then we made a duplicate to fit it. The same things are going to happen here, except instead of plastic, we're dealing with chromium cobalt, something more rigid, non-precious metal. It needs to be a little bit more exact and a little bit more precision. We just can't go fill that guide plane full of metal and then go adjust it like we would acrylic. It would just be way too much trimming and very laborious. So number 1 is we're determining the path of placement with our survey table, and I'll talk to you in the demonstration of how we go about that. For now, I need you to recognize these 9 things and try to visualize what I mean by each one. Number 2 is we're identifying guide planes. Now, if we know that there's a prosthetic 2.2 in this picture, that the guide planes, as I mentioned earlier, are the proximal surfaces of 2.1 and mesial of 2.3. And we will identify these guide planes with the surveyor and then identify how much or how little undercut there is on either side. And then we can determine to block them out or not block them out or have restorative procedures done. So we need to identify the proximal surfaces of the guide planes of where the partial denture is going to fit. How it's going to, the path of insertion will slide down these guide planes. Now, for our first case, Kennedy Class 1, it will be the distal guide surfaces of 3.4 and 4.4. As well as on the second model would be similar. But we're going to do different major connectors. So basically, you got a couple tries at the first Class 1. You can see here with the survey spindle, or excuse me, the analyzing rod, how parallel it is to the guide plane or proximal surface here of, looks like a 3.7 or 2.7. Regardless, this molar on the mesial surface, the guide surface, is parallel to the survey spindle. But if we move that analyzing rod, survey spindle, the analyzing rod, if we move it over to the distal proximal surface of the second bicuspid, that you will see that there will be an undercut created here. If I can kind of superimpose maybe a red pen here. So if I parallel that to this red line, I'll try to be straight here. You can see now there is an undercut on the distal proximal surface of the second bicuspid. On the molar there is not. What we should try to do, if we're not going to do any restorative procedures, is balance these undercuts out, meaning equalize them between the mesial of the molar and the distal of the bicuspid. So conversely, you can change the angle of that survey table as such here, and now you have no undercut on the distal proximal surface of the second bicuspid, but you've created a huge one on the mesial of the molar. So somewhere in between. There's no right or wrong, there's just better and not as good. Obviously, if we could prepare these guide surfaces to have more tooth contact in the path of insertion, that would be optimum. But we would just change the tilt of the survey table. Now, the first case I've given you very simple. It's just the distal guide planes of the bicuspids. So you're not really involved with multiple guide planes. There's just two. As we progress into further complex cases, there'll be 2, 3, 4, 5, 6 guide planes, where we'll have to kind of keep all of them in mind. Another reason for surveying is identifying the undercut areas. So if we look on the far left now, let's not be distracted by the one, right? We look on the left here, and there's an analyzing rod actually touching the height of contour, or the widest circumference of the tooth at a certain angle. When we change that angle, the height of contour changes, either higher up the occlusal or lingual surfaces or lower. So if I can mark here in red, this is the height of contour, the left bicuspid here in A. And on the right side, here's the height of contour. And you can see by the dotted line that that's parallel base. When we tilt the base, like in picture B here, to the left, I've moved an arrow down, we can see that the height of contour on this side of the arch, if we can kind of suspend our imagination, these bicuspids are on either side of the arch, left and right. Whether it's upper or lower, it doesn't matter. So on the left side, you can see the height of contour is higher, and you can see the height of contour is lower. So when we're identifying these undercuts, we're trying to balance them and utilize them for the clasping system that we're going to use. Which clasp? That is the next lecture, which sometimes I'd put it first, but this time I'm going to put it later, about our superbulge and interbulge clasps, all 9 of them that we have at our disposal to design a cast partial denture. As of today, you have your Kennedy class identification and major connectors to your disposal. Now we need to know the types of clasps that we have, or minor connectors that we have at our disposal to design our cast partial. We utilize the surveyor to identify these undercut areas, either utilizing the ones we want or discrediting other clasps that we cannot use, and some that are more favorable, and some that may be more favorable for aesthetics, and some least favorable for aesthetics. Some more favorable for retention, and some least favorable for retention. So, like I said, there's no perfect right or wrong, but there's just getting closer to optimum. So if we could balance the undercuts on left and right for our first cases, this would be our goal. And once we get accustomed to using our surveyor, then we can get a little bit more elaborate in changing guide planes and changing path of insertions to optimize this. Now, today's exercise, you'll be tripoding, analyzing, and identifying the undercuts on your first 2 models. And I'll demonstrate that later on. Here we've got some more visuals of a second molar, and there's an analyzing rod blown up here on the right, and you can see that it's the height of contour is here. If we change the angle more this direction as my arrow, then we would minimize this undercut here. Okay? Now, I'm just putting this analyzing rod at the guide surface. If we were to run it along the outside buccal confines of the tooth, you might have a height of contour as such. And this height of contour is marked, you guessed it, with the carbon marker that we have in our surveying kit. Once we analyze the correct path of insertion, then we'll swap that out for our graphite, and then we will actually mark the height of contour. Not just on our abutment teeth. As an exercise, we'll make a height of contour on all the teeth. So another reason for the use of surveyor is evaluating soft tissue undercuts. So here we have a cross section of a mandible where the lingual bar, which we know is 3 to 5 millimeters below the CEJ of the lower anterior teeth or even posterior teeth, roughly 3 to 5 millimeters. And if there is a depth in the vestibule that is undercut below, let's say the root eminence there, as you can see in the picture, that this would be the path of insertion. You can see the lingual bar here, and then going down further in this direction, that it's going to hit this tissue. If we put the bar right 0.3 to 0.5 millimeters off the tissue, which you know it is. So in this case, the lingual bar would have to be out in this area here. Sorry for the sloppy drawing. But it would be out there, and then now we don't have our 0.3 to 0.5 off the tissue, creating, a huge speech impediment and food impaction. So then maybe now we change the major connector. And you already know that if we don't use a lingual bar, most likely we'll use a lingual plate, which will finish up here and then cover the cingulum and come down something like this. And kind of avoiding that undercut in the lingual sulcus there. So we use the surveyor to evaluate these soft tissue undercuts, not just hard tooth surfaces and hard tissue undercuts, but soft tissue undercuts. Here we have a kind of extreme wax up, and you can see and experience, if this was a transitional acrylic partial denture like we made last year, you know that this will not fit, and nor will it come out unless it comes forward towards us. It has to go over these guide planes of 1, 2, and if I just put a red line here, that's the color I have, you can see that we'll be eliminating a lot of this here in this section. So we want to evaluate for aesthetics. If we just put wax in there and say, yeah, it looks great, but that's not a finished product. We need to evaluate aesthetics that once this guide surface is in there, we might end up with this kind of unsightly dark holes distal to the centrals here. So then we need to minimize that either by changing the path of insertion if we can, or asking for some restorative procedures, which is another reason for surveying coming up, where we will ask the practitioner possibly if they could shave down the abutment teeth or the guide planes of 1, 2, and 2, 2. And by shaving these guide planes, we could minimize those unsightly black holes there, which I think you agreed that you had on your acrylic partials on 1 or 2 of them last year. So we're going to evaluate aesthetics. Back to our lateral. Is it better A or B? We decide which one's going to minimize these kind of problem zones in here and in here, and which one is more in the smile zone, the mesial cervical third or the distal cervical third, depending on the smile line. If the smile line is really low, then I think we could get away with it, unless they're big laughing guffaw. They might see those unsightly holes I'm talking about. Now, we just can't go and ask the dentist, go ahead and lop off 1/3 of the central to minimize this. I mean, that's just not going to balance the aesthetics. I think if we can create some guide planes, maybe do some creative overlapping, possibly, we can minimize that. And hopefully this tissue, once there's an extraction, doesn't start to recede up here, the tissue. It gets higher and higher, and there's more bone exposure of the distal side. So hygiene's obviously important too. So evaluating aesthetics in the aesthetic zone. We have a project, Kennedy Class 4, coming up next semester where we're going to think about that. Here we are locating and delineating the survey line. So you can see once I've decided on the path of insertion, I've marked the height of contour with a graphite pencil. You're going to do this today. Once I've marked the graphite with a red black pencil, I'll swap it out for a 0.25 undercut gauge like in this picture, and you can see that it is touching the tooth right here. This is touching the survey line or the height of contour, and the undercut gauge is 0.25 millimeters touching the tooth here. So this will be the terminal end of a clasp, let's say. So let's simulate this would be our most popular Acres clasp or E-clasp, that only the terminal third of a cast chromium cobalt wire will engage below the height of contour. Only the terminal third. So if I draw this, which you're going to do today, most likely, that the clasp stays on or above the height of contour and then dips down below the height of contour and engages the undercut right here that I'm demarcating in red. This here is very passive, this part of the clasp here. This is a very passive part of the clasp, doesn't engage, only the terminal end. Last year we had wrought wire clasps that we could maybe engage a little bit more because they're more flexible. The modulus elasticity of an 18 gauge stainless steel wrought wire is higher. But chromium cobalt is pretty stiff, pretty rigid. So 0.25 millimeter undercut. This may not make sense to you, but once we go through the practical, it will. Maybe here's a picture in the dark where you can see the analyzing rod hitting the height of contour, which we marked in graphite. And you can see how much undercut there is in the shadow below. And we're going to put our undercut gauge in the previous picture like this. And you'll see it touches the tooth down here. The undercut gauge will probably be somewhere about here. If I would simulate that red line as 0.25, and then we're going to mark that with our red pencil. And then depending on the clasp we choose, we will engage that with our cast chromium wire. It's very particular in chromium cobalt technology that we're more exact, because bending the chrome after it's cast, most likely we're going to fatigue it, we're going to work harden it, it'll hit its ultimate strength and then ultimate yield point and will fracture. It will fracture over time. Even if the client starts playing around with it, it's going to fracture. If we put our clasp down here, this is a big, I'm going to put an X here. This is a big no. Where's my, oh, I lost my pen. This is a big no here. This is a big no, the second one here. The whole 100% of the clasp is below the height of contour. There's no way that that chromium cobalt will flex to get into this undercut area. This is the undercut we're going to utilize, and roughly we'll do a third, so I'll do 33% of our cast clasp will engage on this molar below the height of contour, and it'll gauge 0.25 millimeters below the height of contour. Now, we dictate the height of contour. We've chosen it at the angle of path of insertion with our surveyor. We will mark the line with our surveyor and our graphite, and then we will measure 0.25 with our 0.25 undercut gauge, and then we will freehand draw, as I've done on my computer, your clasp for the first case. Now, before discussing all the clasps, maybe I'll just discuss the one that we need, and then we'll backfill the information so we can keep busy today, possibly even go all the way and finish it off. One more reason for restorative procedures, one more reason for surveying is determining restorative procedures. So now here on the left, you see that there's some ledges on these crowns, that these ledges are parallel to the path of insertion because they're passive ledges. These are the reciprocative arms of the double Acres clasp you see on the right, which we'll talk about in depth, or the double E or the Bonwell, whichever you choose to call it, or embrasure clasp. The one on the right is an embrasure clasp. The reciprocal arms are that on the lingual. Those reciprocal arms cannot engage any undercut. So I've taken away any undercut. I've even milled the ledges of those crowns that they are perpendicular, those ledges, to the path of insertion, almost rest stops as well, preventing any vertical displacement of this partial denture. I mean, that's a lot of information just to look at this picture. This would be something we'll do in third year, but milling of the abutments would be more advantageous. We'll talk more in depth. But our surveyor, whether it's a high fancy one to do the milling of those ledges, or we will use the wax scalpel to scalp out those ledges in our wax up of our crowns. So now you're thinking, wow, okay, partial denture technology meets crown and bridge class. They are separate for today, but in the future it's all one. Here's a picture on the next slide of using the scalpel wax blocking out undercut is all I'm doing. Just trying to simulate maybe the ledge of a crown. Here you can see, even though it's not chromium cobalt, it's an acrylic partial model, and you can see how that acrylic is binding on the tooth. You saw this last year, and that's why I put acrylic partials before cast partials, so you can experience painfully the fitting of the acrylic partial over the abutments. Last year I said, well, how much do you relieve to make that fit over that abutment? And I said just enough. Some of you went just too much. Some of you went just not enough. You somewhere in the middle. Some of you made your dentures so loose that they would fall out, and some so tight that they would bind. In chromium cobalt technology, we're going to measure that undercut. We're going to block it out. It's going to be perfect. We have no time to over adjust. There's still adjustment as it is with the shrinkage from the casting process, etc., and all the duplication, that we just can't go ahead and be vicarious by filling in these undercuts with chrome and expecting to relieve them all. In plastic, a little bit easier. Take your burr, adjust this section here. That's binding on the abutment tooth. It's transitional, tissue supported regardless. And then the next picture, you can see it slide down. Okay, this is a simulated model, but what I'm trying to simulate with these pictures is this undercut right here that I'm going to mark in red. This is what I relieved. Here's what you'll block out in chromium cobalt, so we don't have to relieve it, or at least not relieve it as much. This is something creative in a picture from Davenport's textbook. It shows an attachment of the anterior flange. But what I want to talk about is soft tissue undercuts. Is if this denture goes in the path of insertion as shown as a number 1 would represent the path of insertion, that means the denture will go in this way. And you will have all this undercut to the labial flange because there's a huge undercut. So now, to minimize this undercut, maybe I need to change the path of insertion to go this way to minimize the undercut of the flange. So it's not just undercut for the clasp and the guide plates. It's undercut for the tissue flanges as well. If you leave that big space under the flange, the patient will definitely not tolerate that, full of lunch and breakfast and dinner and who knows what else. So most likely the practitioner will, chop the flange off there and shorten it, but that might not look good aesthetically if they got a whole smile line. All could have been changed with a different path of insertion. Here we're delineating the survey line is another reason for our surveyor. So I've dictated the path of insertion, I've locked my survey table, and I take my graphite and I mark the height of contour, or HC in the picture here, the height of contour of all the way around the abutment tooth. And this is the widest convexity of the tooth, the natural tooth, at a given angle. And once I've marked the height of contour, it's shown here in graphite. This is a little bit sloppy, so you need sharp pencils. So the black here, or the graphite, are the height of contour. The red are the clasp lines. This one's doing about 50%, and this one's doing about 50%. So this is the undercut that should be 33% that I'm going to engage below the height of contour with my retentive arm. The only retentive arms you made so far are, I guess in ortho you've made some different retentive arms, but in acrylic partials it's just the stainless steel wrought wire clasp. And I told you to put it down there somewhere, halfway between the gingiva and the occlusal of the tooth. we're going to do this today on our one abutment tooth on each side of our class 1. Here again is path of insertion. If the path of insertion goes in this way, we'll have this undercut. So also path of insertion, not just on the height of contour, but also for plating of major connectors that were not into the CEJ undercut. So we're going to delineate and block out those two. Here is the last reason for surveying. Once we've dictated our path of insertion, you can see here there's a survey table with a model in it. And I've taken the analyzing rod and laid it at the side of the model and then marked with a pencil here. So I can illustrate with a pencil here the angle of the model within the table. So if I took that model out of the table and then the table was used for something else, I can put the model back in the table and put it at the same angle as it was, so I don't have to go through all the exercises of left lateral, right lateral, protrusive and back, or anterior and posterior, to find the optimum path of insertion that, I spent 5 minutes, looking at the abutment teeth if it's a complicated case. Our first case is a little bit simpler than that. We've only got 2 abutment teeth to look at, but once we dictate the path of insertion, which I'm telling you right now will be very close to 0, assuming our base of the model is trimmed parallel to the plane of occlusion. So if your model is not flat, from a thick base, it's always imperative, whether it's full dentures or partial dentures or even crown and bridge models, that the base of the model be parallel to the plane of occlusion. So if that's off, the table might be flat, but my teeth are on an angle because you didn't make a base flat enough. So eyeball the plane of occlusion parallel with the base. Most likely you'll start at a set 0, this table at 0, meaning not tilted anterior, left or right, or posterior. Once we've decided on our path of insertion, measured the height of contours, or analyzed the height of contours, that would be useful for our case, we're going to tripodize the cast. This is one way of tripoding. One line and then another line at the base of the model. This purpose of tripoding is to replace the model back to the surveyor at any given time at that angle. That's all it does. Tripoding is just a memory device, so we will be able to illustrate and put the model back to the surveyor quickly and efficiently at the same angle. Now, we're going to tripod it both ways. This is one way, and I'll show you in the demonstration, and this is another way. 3 widely spaced points at the same angle. So if you look at this triangle here, this triangle, or these 3 points, is on the same plane, meaning the same height. Where it hits the model doesn't matter. It should be wider spaced, but because of the class 3 vault on this model, maybe they didn't want to go up higher. I mean, you could, put 1 mark here, wherever it hits, 1 mark here, and 1 mark here. 3 widely spaced points at parallel. And then I'll show you how the College of Dental Technologists expects to see that on their surveyed and analyzed models. Here's another picture of tripoding, where you can see you use the analyzing rod and you'll mark it, or you could use a graphite, just don't break the graphite. And then 3 widely spaced points. There's 1 here, and you'll demarcate that with a little X and a circle around it. I'm just outlining it in red, but you can see close up there that there is a X. I'm going to make it an X. And then a circle around it, and this is done only in pencil, in graphite. And you can see on the top picture on the top left, similar. So, the last reason for tripoding is tripoding the cast. Now I've been rambling here pretty good. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9 reasons to survey. I'm going to ask you to memorize those 9 reasons, and we're going to have a little quiz next week on the 9 purposes of surveying. I'll go through some other illustrations here that maybe might clear up a few things here. So here we have our, it's a retentive arm. It looks like a wrought wire retentive arm cast into a chromium cobalt. But regardless, if I could superimpose, and let me change this to a black one so we can use the right color, for goodness sake. So if I was to go over with my height of contour, you can see it was kind of rubbed off here. It was probably something like this, the height of contour, in the black line that I've drawn. Hopefully you can see that. So this wrought wire clasp is engaging below the height of contour in these blacked out hash mark areas. This is the active part of the arm. This is part of the arm or the retentive arm that flexes, open, closed. Path of insertion, it flexes open. Path of dislodging, it flexes open and releases itself from the bulge of the distal of that molar. So this is really important that we make cast partial dentures that fit somewhat passively, but yes, retentive. How much retentive? Not just enough, exactly enough. 0.25 millimeters into the undercut of that abutment tooth. Now, the depth on the tooth doesn't really matter. It all depends on the shape of the tooth. So you can see here, this is from Davenport's textbook, picture number 1 on the left, where we have the height of contour similar to the one on the right, but the throw of the clasp, or the length that it has to travel to dislodge. These arrows are the path of dislodgement. How long does that tooth, that clasp, have to travel along the buccal surface of the abutment tooth before it's dislodged off the tooth, depending on the shape of the tooth. So you can see here the height of contour is here. The clasp sits here when it's in situation. Once it comes to dislodge, it goes over the height of contour here. But you see the difference between here and here? It's not that much. Over in the picture on the right, depending on the shape of the abutment tooth, this clasp has to travel a lot longer to get over the height of contour. Not necessarily meaning one's right and one's wrong. I'm just saying the depth of the undercut is not arbitrary. The depth is the depth depending on the shape of the tooth. The shape of the tooth can be changed by the dentist if we choose to. If the dentist chooses to change, maybe you're not getting number 2 up there. I'm going to move this up a bit. There we go. We're missing the top of the screen a little bit. So the abutment teeth can be shaped and changed clinically. And this is one of our reasons that we talked about earlier, was determining the restorative procedures on the abutment teeth. The length of the clasp doesn't matter either, but I'm showing here another one from Davin's textbook. This retentive arm is 15 millimeters long, and if I was to superimpose the height of contour, maybe it goes something like this, the widest part of the tooth. So only this 1/3, we said, engages below the height. This would be 33%. This is on average, 25 to 35%, somewhere about 1/3 of that retentive arm is below the height of contour and is active. How much active? Well, we don't want it too deep because this chrome won't flex. It's not going to flex 0.75 millimeters. It's going to flex 0.25, and even best at times, not even that much. There's not as much memory in the chromium cobalt cast arm as there is in a wrought wire stainless steel clasp. Here we have another slide coming up here with the tissue undercuts. Again, this is just going over the same old with different illustrations, hopefully to hit the message home. So we're delineating soft tissue undercuts. This blue thing here, let's say it's a plate or even an eye bar, that it cannot engage in this area at all left of itself. This is all undercut here. These undercut here, the chrome will not bounce and flex out of this undercut. So we're using our surveyor to either utilize the undercuts we want for our clasp and also block out the undesirable. So we've got desirable and undesirable undercuts. We choose which ones that we want to utilize. Obviously, we're going to utilize 0.25 millimeters of the abutment teeth to retain the partial. Here we are, again, locating undesirable undercuts from the aesthetic zone. That these areas here in the middle third, close to cervical third, these are not, these are undercuts. Sometimes we can't avoid them. You just can't go and make guide planes. You can see how they flatten the surface of 2-1 restoratively, but we just can't go ahead and eliminate them completely. And then this is really important when we come to implant treatment of this tissue maintenance, where the extraction has been or where the implant was placed, that we're going to expect that there'll be a lot of grafting that would happen surgically to maintain this kind of bulbous section of the implant, so aesthetically it's pleasing. Especially for the cost of implants, you don't want to go all through the cost of an implant and have the same result as you would a flipper with these undercuts and the tissue management. That matter, partial dentures or cast partials. Like I said, we can't solve the problem all the time, but at least we're aware of it. We're not just treading vicariously through it all. Here we have our soft tissue undercut. This happened with your flange and your acrylic partial last year in the posterior section, that this has to be relieved. But if we blocked it out or we changed the path of insertion, maybe we can have this denture going on an angle slightly lower, more anterior. You can see my arrow below the other arrow. Maybe change the angle slightly, and then we don't have to adjust this one as much. So we've got some procedures now for surveying our master cast. Number 1, align the guide planes. Number 2, identify the undercut areas. Number 3, delineate the height of contour, mark the undercuts and tripod of the casts. You'll see me go through all of these in the demonstration to follow after the break, and then my expectation is that you go and repeat these steps on the models that you have. You have 2 models. We're going to start with the larger model, our first project, and we will start by getting accustomed to our surveyors and utilizing them effectively with the help of all of us in the classroom. And I've got a typo, undercuts. There's an E missing, something missed. Regardless, undercuts. We're going to use our analyzing rod, and we're going to determine, first of all, we're going to recognize where the height of contour is, left and right, and then we want to balance it by moving our survey table left and right. I'll do this in the demonstration. You will do it as well. So the height of contour on the buckle of the 3-4 is similar to the height of contour of the one on the 4-4. The undercut between gingival margin and here is roughly around the same height as there. The shape might be different, but the height of contour is around the same place. So aesthetically, when we're looking at the client, that the clasps finish around the same part of the tooth. We don't want one way up high and one really down low. And we can change where the height of contour is by the angle of the table, which we're going to do. Once we've analyzed the correct angle, we'll tripod the model. We'll delineate the height of contour with graphite. We'll mark it, and as an exercise, I think we'll mark all the teeth. Even though not just the abutment teeth of 3-4 and 4-4, but we'll do 3-3, 2-1, 1-2-3, all the way around, just so we can get used to using our surveyor. So we'll have a break, and then we'll come back and demonstrate our surveyor and go over all these reasons for surveying once more. Thank you.